So can you talk about this tablet? Why is there just one here in this pack? And it seems to have something called as levonorgestrel. What is this? And it's also called as easy pill. Okay, it's written here. It is oral emergency contraceptive for women. What does it contain? It contains levonorgestrel, that is progesterone. So this is a progesterone only pill. And how much progesterone does it have? It has 1.5 milligram of levonorgestrel. So how does it work? It is supposed to be taken as soon as there is an unprotected sex and you want contraception, you do not want to get pregnant, then you can take this tablet. It should be taken as early as possible, within 72 hours if possible, within 5 days also okay. So what else? So how does this work? This has so much of progesterone that it will not allow fertilization or even ovulation for that matter. So, but it is not an abortion pill. If you're already pregnant, it will not abort the fetus. It is not going to do abortion for you. It is just a contraception so that you do not get pregnant, right? So first, some anatomy here. This is the uterus. This is the cervix at the bottom. This is the vagina. From here is where the sperm enters, okay, and then it travels through your cervix, goes through the uterus, goes to the fallopian tube, and here it meets the egg which has been just released by the ovary. The fertilization occurs here, then the cells, mass of cells, they come here, and then there is a blastocyst, whatever blastocele, that will try to implant here. So basically, in this case, the sperm has entered, let us say, this tablet will try to prevent ovulation, and it will also try to prevent fertilization. That is the main action of this emergency contraceptive pill. The textbook says that it doesn't actually prevent implantation. Okay. So this is also called as the morning after pill. So you can see here it's written morning after pill. Also it can be called as, so this is a post-coital pill or a post-coital contraception. And when would you suggest that? When the person doesn't want to get pregnant but has had unprotected intercourse, unplanned intercourse, there is a condom rupture, or they were on some other oral contraceptive pills and they missed taking the pill for longer than however. And if there is a sexual assault, so you know when to give an emergency contraception. Do you know that there are many types of emergency contraception? This is the one that they're talking about here, POP, that is levonorgestrel tablet. So basically they are saying it is POP, progesterone only pill. So you have to take 1.5 mg. In this they have put both 1.5 mg, 1.5 mg is there in total. However, you can also take 0.75 mg as soon as you realize, and after 12 hours you can take the remaining 0.75. This should happen within 72 hours. You should take the first dose. That's what the textbook says, isn't it? See, the first dose should be taken within 72 hours. If it is really not possible, within 5 days if you take also, it is good enough, they are saying. Okay. But pregnancy can still occur. Okay. Then let's go back here. Emergency contraception is not just progesterone only pill. You can even put an IUD for the person. Ulipristal acetate you can give. You can also give combination of progesterone with estrogen. You can also give antiprogesterone. Okay, mifepristone. You would have heard this term overall. You know, that is nothing but levonorgestrel and ethinyl estradiol. That is nothing but contraceptive pills, right? Oral contraceptive pills that you regularly take, something like this one. Okay. So 2 tablets of this also can work as a emergency contraceptive if taken as early as possible, they are saying. Okay. And after 12 hours, you should take 2 more tablets. So you need 4 of these tablets, not these ferrous fumarate tablets. These 2 and then 2. Okay. But this is actually a little low dose. What I'm seeing is this one is a little low dose. What they have mentioned here is a little high dose, I'm thinking. Okay. That overall is nothing but this one, ethinyl estradiol plus norgestrel. Okay. That is nothing but combined oral contraceptive pills. 2 tablets if you take, and then 2 more after 12 hours. Okay, that's what they are saying. 2 tablets stat and 2 after 12 hours. But here the stat should have been within how many hours of the intercourse. That they have not mentioned. That is what they mentioned here in this place. Less than 72 hours. Less than 72 hours, you remember, for everything it will work for you. Okay. As early as 72 hours, within 72 hours you should take. At home, if oral contraceptive pills are lying like this, which could be lying like how it's lying with me, taking 2 tablets, or based on the dose you will have to take, right? Very curious to know how it how it is to taste actually. Let's just check. There's only 1 tablet. Okay, all these are just some design. So this is a white tablet in it, and remember it has 1.5 mg progesterone, levonorgestrel. So we'll break it. So this is the tablet now. It's not having any taste actually. It's nice only. Taste is nice. Though that doesn't matter because you're going to swallow it. So this is how levonorgestrel, the emergency easy pill, is for taste. This is having 1.5 mg of levonorgestrel, that is progesterone. And this is easy pill. It is oral emergency contraceptive pill to be taken within 72 hours of unprotected intercourse, and if you do not want to get pregnant. Do you know the gold standard emergency contraception? It's written here, see? Copper IUD. Spermicidal copper will be. Okay, so it will just go and kill the sperm. That's what it will do. Okay.